Hello guys, Assalamu alaikum. I hope you will be fine. My name is MD Mahabub Hussain. Today we will discuss symptoms and treatments for skin cancer. So let's go. Cancer is one of the most feared disease among the individuals, and people suffering from it are also in fear. But the best way to remove the fear from the cancer disease is the detaining the cancer on the early stage and getting the scope of removal of it from your body. Skin cancer is the most common cancer. About 5.4 million basal and squamous cell cancer are diagnosed each year. They are found in about 3.3 million Americans. Some people have more than one. Melanoma, the deadly type of skin cancer, will account for about 76,380 cases of skin cancer in 2016. The article explains about skin cancer and its causes. Skin cancer is common and locally distributed. Malignant or cancers grow of the skin. It originates from the cells that line up along the skin membrane that separates the superficial layer of skin from the deeper layers. Unlike cutaneous concrete melanoma, the vast majority of these sorts of skin cancer have limited potential to spread to other part of the body and become life-threatening. There are commonly three major types of skin cancer. Number 1. Basal cell carcinoma, most common. Squamous cell carcinoma. Melanoma, which originated from the pigment producing skin cells. Basal cell carcinoma, most common. Basal cell carcinoma is the most common cancer in humans. Over 1 million new cases of basal cell carcinoma are diagnosed in the US each year. There are several different types of basal cell carcinoma, including the superficial type, the Let's origin variety, the nodular type, the most common, and the Murphy form, the most challenging of treat because the tumors often grow into the surrounding tissues without a well-defined border. Squamous cell carcinoma. Squamous cell carcinoma accounts for about 20% of all it, but is more common in immunosuppressed people. In most intense, its biology behavior is much like basal cell carcinoma with a small but significant change of distant spread. Less common include melanoma, Merkel cell carcinoma, Athi- atypical fabrication anthoma, catinoids, lymphoma, and dermatofibrosarcoma, melanoma, the most dangerous form of cancer. This cancer's growth develops when unpaired DNA damage of skin cells, most often caused by ultraviolet radiation from sunsets to tanning beds. Triggers mutation genetic difference that lead the skin cells to multiple rapidly and from malignant tumors. These tumors originate in the pigment producing melanocytes in the basal layer of the um, epidermis. Melanomas often resemble moles. Some develop from moles. The majority of melanomas are black or brown, but white can also be skin colored pink, red, purple, blue, or white. Melanoma is caused mainly by intense occasional UV expire frequently leading to sunburn, especially in those who are genetically predisposed to the disease. Melanoma kills in estimated 10,130 people in the USA annually. If melanoma is recognized and treated early, it is almost also curable, but if it is not, this can advance and spread to other parts of the body where it becomes hard to treat and can be fatal. Risk factors for skin cancer include: number 1, too much exposed to ultraviolet radiation from sunlight to tanning beds and lamps. Number 2, pale skin, easily sunburned, does not tan much or at all, natural red or blonde hair. Number 3, exposure to large amounts of coal tar, paraffin, aerescence compounds, or certain types of oil. Number 4, you or members of your family have had skin cancers. Number 5, multiple or unnatural moles, severe sunburns in the past, weakened immune system. Number 7, older age altered melanomas are also found in younger people. Signs and symptoms of skin cancer. Skin cancer can be found early, and you and your healthcare providers play key roles in finding skin cancer. Learn how to examine your skin your changes. If you have any of these symptoms, see a provider. Any change on your skin, especially in the size or color of a mole growth or sport or a new growth, even if it has no color. Scalines, roughness, oozings, bleeding, or a change in the way an area of skin looks. A sore that does not heal. The spirit of pigments, color burden beyond its border, such as dark coloring that spreads past the edge of a mole or mark. A change in sun situation as such as itchiness, tenderness or pain. How to prevent? Many types of cancer can be prevented by avoiding triggers that cause tumors to develop. Prevention strategies include protection from the sun by the use of sunscreens, protective clothing, and avoidance of the sun during the peak hours of 9 a.m. to 3 p.m. Parents should ensure children are protected from the sun. Do not use tanning beds, which are a major causes of excessive ultraviolet light exposure and a sun-fleeting risk factor for skin cancer. How it is treated? In choosing the best treatment option, the doctor will consider your age and general health, the type and size of cancer, what is on your body, and what you want. The treatment choice will also depend on whether the skin cancer has spread elsewhere in your body. Type of treatment include surgery, freezing, scalping, radiotherapy, chemotherapy. Skin cancer is the most common form of cancer in the many countries. The two most common types are basal cell cancer and squamous cell cancer. They as usual from on the head, face, neck, hands and arms. Another type of skin cancer, melanoma, is more dangerous but less common. Anyone can get skin cancer, but it is more common in people who spend a lot of time in the sun or have been sunburned, have light colored skin, hair and eyes, have a family member with skin cancer, are over age 15. Sahil Parjipti is dedicated content writer who loves to write on the varied topics to in universities and college issues, and making a habit to deal with the some their topic. Thank you so much for watching this video.